Hello, everybody, and welcome to Five Questions. I'm Sarah Downey, and I'm the president and CEO of the Michael Garron Hospital in Toronto. And it's my pleasure to welcome back Dr. Janine McCready, who is an infectious diseases doctor and associate director of infection prevention and control. Thank you for coming back. I know how busy you've been protecting our hospital and seeing most of our COVID-19 patients. So thank you for coming, Dr. McCready.
Thank you for having me.
So, Dr. McCready, I've asked you this question before, but it seems that there's always new evidence coming out. So I'm going to ask it again. And can you tell me, has the evidence changed on COVID-19 transmission? I heard that it could be an airborne illness.
So great question, Sarah. And I mean, as you know, we're always reading every study as it comes out, making sure that we're on top of everything. And there has been no new evidence and nothing new that has come out. In the last few weeks, there was a group of scientists that put together a commentary, and then that promoted a lot of headlines and a lot of new kind of reinvigorated the debate. And so what they raised is that they mainly said that in experimental conditions and in indoor, crowded, poorly ventilated environments, there's a possibility for the transmission via aerosols. So their main arguments were actually for ensuring adequate ventilation and avoiding crowding in public places, both of which with which I agree. But that kind of sparked the renewed airborne debate. And really, we have no evidence to suggest that in real world clinical experiences, there's any airborne transmission. And so with airborne, an infection that would be airborne would be something like measles that could linger in the air for many hours and travel distances. So if I had measles and I left and someone came into my office 2 hours later, they could get measles. COVID-19 does not behave that way. And there's been no real world compelling evidence that it has shown any real transmission in that manner. And certainly in hospitals in Ontario, in Toronto, in Canada, even in Europe, in Australia, New Zealand, the main precaution that we use is droplet contact. So a mask and your face shield. And we've seen no evidence of widespread transmission in those environments. Additionally, there's been some events that happened that have given us even more faith that is adequate protection in hospitals. There was one event in the United States early on in the epidemic where someone presented with COVID-19, but before anyone recognized it. And there was 121 healthcare workers that helped to work on that person. Many of them actually didn't even wear masks, and they intubated them, they extubated them, they did procedures that would be aerosolizing procedures, and only 3 healthcare workers actually acquired COVID-19 from that experience. 2 actually didn't have any mask on at all, and 1, they were wearing just a droplet mask. So very low risk. And there was another study from Singapore that 41 healthcare workers were again exposed to someone, and they were all wearing just droplet contacts, so not an N95, just a regular mask, and none of them acquired COVID, and they all had serial testing, and they were all negative. So that's healthcare evidence. And then in real world, we know that on airplanes, the actual spread of COVID-19 is very small, and within households, most of the rates in the studies are somewhere between 10 to 35% of household contacts acquire COVID-19. Whereas in an airborne infection like measles, more than 90% of household contacts would acquire the infection. So I feel very reassured that what we're doing is working. I mean, personally, I've seen, I think, nearly 150 patients with COVID-19 here in the hospital, and you know, knock on wood, I've remained well, and I feel protected by the droplet contact PPE we're using. So long-winded answer, but I think it's an important question, and I appreciate you asking.
So that kind of lends its way into my next question, and that's as Ontario prepares to move into phase 3. Some communities already have. What do we need to know to keep ourselves safe as things start opening up and returning to some form of new normal again?
Great question. So, I mean, I think the one thing to remember is that everyone's going to have a little bit of a different level of risk tolerance. And just because something is open doesn't mean that there isn't risk to it, and doesn't mean that you should feel compelled to go there if you don't feel comfortable. So I think the important things that we all need to consider as we start engaging in these activities is, first of all, wherever you're going, do you have any symptoms? And if you or anyone you're going with has symptoms, you should stay home. and not go, because you're going to, obviously that's going to put everybody at risk, and you should go get tested, even if they're mild symptoms that you would normally ignore. Then ask yourself, are you vulnerable? Are you someone that is more likely to have severe disease? So do you have diabetes? Are you overweight? Are you older? If those are the case, or if you're going to be seeing someone that is more vulnerable, then you should change maybe what you're doing to minimize the risk. Then look around, see what the news is putting out, what the rates are of COVID-19 in your area. If you're living in Nunavut, where they haven't had any cases, then for sure your risk tolerance, your ability to do these activities is much lower, versus if you are traveling to Florida, please don't go near anyone. And then what activity you're doing. So I would still say avoid crowds, avoid indoor closed spaces if possible, and avoid close contact. So outdoors is always better than inside. And if you are going to go have a picnic outside with a group of people, if they're outside of your household or your bubble, then try not to share utensils or share potlucks. Everyone bring individual samples, sit on picnic benches apart, or on blankets on the floor, so you can still get together with people, but do it in a safe way. And if you are going to go inside, then try to maintain physical distance, and then do things to mitigate that risk. So wear a mask, and then think about where you're going and if you can maintain safe behaviors in that environment. And so I think the most important thing we need to remember, and we've seen across the United States and some little blips of resurgence across the country, a little bit in Alberta and then some reports in Quebec, and hopefully not here anytime soon, is that COVID's not gone. And we would like it to be more than anything in the world, but we still have to keep our guard up and make decisions that are going to keep all of us safe.
That's great. The other really hot topic, and I know is we're both parents of school-aged children, is the whole topic is it safe for kids to return to school in the fall? And if it is, what kind of considerations should we as parents and the schools take into account if kids go back to school in the fall?
Yeah, so this is a very important topic. And I mean, I think a lot of it depends on the levels of community transmission and what we're seeing. But I think, school, as we've been saying throughout all this, school is one gathering that really we can't cancel indefinitely, and that children need to go to school for their mental health and their growth and their education. And so we need to put in safeguards to make them do that safely. So what we're going to be hoping to see from the school boards and from the Ministry of Education as they start to roll out the plans for reopening is that they're going to consider robust screening programs. So not letting kids, again, you're going to hear the same themes. So not letting kids come to school when they're sick, and making sure that parents understand that. And it's to keep everybody safe, to keep the teachers safe, to keep the family safe, to keep the kids safe. Because there's a lot of talk that maybe kids don't transmit the virus as efficiently, but obviously if you have a big gathering of children all together, there's still going to be some transmission, and we are still understanding that. Fortunately, most kids seem to not get very sick with the virus, which is encouraging, but still I think we want to minimize as many children getting sick as possible. So I think screening kids is important. And then once they're at school, I'm hoping to see plans from the school boards and the minister about lots of good hand hygiene and planned hygiene throughout the day. And then as much as possible, physical distancing and lower numbers of cohorts in the schools to facilitate, a safer environment. So not full classrooms with the 30 kids that we sometimes see, more outdoor learning. And I think with kids, if we're able to do that safely, there probably is still some role for kids wearing, depending on the age group, wearing face shields or masks within the classroom. But I think that will be more dependent on specific, how old the children are, how many people are in the class, what they're able to maintain, and then as well what the teachers are comfortable with. But those are the things that I'm looking for when I look at the plans for reopening, and I hope to see in the coming weeks.
Great. So given that it is stage 3, I know some of my friends and neighbors are thinking about going back to their workplaces. We, of course, have been working through the pandemic. For many people, they've been away from the workplace for a long time. So what advice do you have for employers and employees who may be preparing to return to their regular workspace?
Again, I mean, great questions. It's very similar to, I'm going to echo a lot of what I said for school. So again, the first thing is stay home when you're sick. And I think, you know, as we think through, so many of us our whole lives, you're used to going to work when you have a little tickle in your throat, or you have a, you know, a stuffy nose, or you feel a little bit unwell because you feel like you're letting your colleagues down. So I think as much as possible, employers have to make people feel comfortable and understand that it's okay and they should not come to work sick. And as well to kind of promote that amongst their employees, because that's the number one way to prevent COVID is if people aren't coming to work, you know, feeling ill, and then they can facilitate ways for people to stay home and work from home and continue to do that if they're not feeling well. And then once they come in, again, create those safeguards. So making sure that within the office, there's enough space for people to maintain that 6 feet. And if they are going to be nearer to each other for meetings or for other things, you know, to wear your cloth mask, and to still minimize big meetings in boardrooms so that you're not having, you know, your whole office in one space where potentially people could be exposed. And, you know, installing hand hygiene so that people can wash their hands regularly. And even in some cases, if your office environment is smaller so that you're worried you can't facilitate that 6 feet apart, then perhaps having cohorts where people can work from home for a week, and then other people work from the office for a week, and then you swap so that there's, if there was someone that was sick, you wouldn't spread it to the whole office. And you're also minimizing the number of people that are being at the office at the same time.
Okay, lots of good rules. But lots of good ways for people to stay safe. And I would say, as somebody who's been coming to work for months, we figured out how to do that. I'm confident other workplaces can. So the other thing is, obviously, people are wearing a lot more face masks. So what do I need to know about properly using and wearing a face mask in order to prevent the spread of COVID-19? Maybe you can teach me how to do that.
Yes, perfect. So very important, and this is one of my pet peeves as I walk around the neighborhood seeing people not wearing the masks properly, and that's the most important thing. If you're not going to use a tool properly, it won't work. So I think the first thing you do before you put anything on, and before really your hands ever go near your eyes, your mouth, your nose, is wash your hands. So you wash your hands, and then you take your mask. Yeah, perfect. You take your mask and you put it on, and I'll let you put it on, and make sure it's covering your nose and your mouth. So, and you want to make sure that you get a mask that fits you exactly. So either one with the ties or one like what you have with the ear loops, so that it's comfortable, goes behind your ears, there's no gaping area. So that one looks great. And then once you have it on and you've got it, you know, in place and it feels good, if you have, some of them have a little metal part above the nose to make sure it's fitting, then you don't touch it. So it's hard not to fiddle with your face, but really the more you touch your face, the more likely you are going to contaminate yourself. So just leave it on, don't touch it. And if you do need to touch your face or your face is itchy, wash your hands first and then take your hands to the face. Then when you're ready to take it off, same theme. So wash your hands, then remove it, and then wash your hands again once you've taken it off. And you can tell I wash my hands about 1,000 times a day from, from just this. Then in terms of storing the mask, so you want to store it somewhere that you're not going to contaminate it. So either, you know, sometimes people have like a hook by their door or in their office. And generally, try not to just stick a used mask in your pocket if it's something you've already used. But if you do, fold the inside on itself so that you're not contaminating the inside of it, which is going to touch your face exactly. And then you can keep it, you know, keep it that way so that you can reuse it. Ideally, people can have a few masks so that they can cycle through, and there you go. And in an ideal basis, you'd wash your masks every night so that you could, you know, make sure they're clean and they're not contaminated. If you don't have that and that's not an option for you, then just store it somewhere safe. You know, hang it up somewhere so that it's not gonna get contaminated. And so I think the main things are make sure it covers your nose and your mouth. Don't wear it under your chin. Don't wear it under your nose like that. That's the worst way to wear it because you think you're protecting, you're not. And then sometimes people have it up on their forehead. Don't wear it on one ear hanging out. So either on properly or off. Yeah. So these are all habits that hopefully people won't do it. And then if it does get wet or soiled, then obviously take it off, wash it, and get a new one. And if it's if it is, you end up having one from somewhere that's a disposable one like one of these, then once you're done with it, make sure you discard it in the garbage, and so it doesn't get left somewhere for people to have to touch and contaminate themselves.
Great. Thank you. And Dr. McCurdy, thank you for spending time today teaching me and teaching our viewers about what the latest issues are with COVID-19 and to give your best guidance, as always, around how to stay safe as we begin to return to some small degree of normalcy again.
Thank
With
you.
that, I say thank you very much, everyone, for watching our 5 questions, and I look forward to seeing you again soon.
Thank you.